Hello, my name is Jill Decker, and this is my presentation on the social factors related to adolescent smoking. In this presentation, I will discuss why adolescent smoking is a public health issue today, discuss a number of behavioral theories related to smoking, analyze past interventions, and identify the best intervention strategy for a selected population. Is smoking really that big of a problem? Yes. In fact, according to the CDC, cigarette smoking is a leading cause of preventable death in the US today. In recent years, great efforts have been made to change laws and social perceptions related to smoking. However, despite these efforts, Americans continue to smoke. According to the CDC, 15 out of every 100 adults in the US smokes, which equates to almost 38 million Americans today. Consequently, smoking is still prevalent behavior, and the map provided displays a 2016 data on smoker concentration by state. States with the highest incidence of smoking are the darkest blue, and these include Ohio, West Virginia, Kentucky, Tennessee, Missouri, Arkansas, Louisiana, and Mississippi. As you can see, every state in the US is still impacted by smoking. Based on these numbers, it's important to consider the medical and financial impact of smoking. According to the CDC, more than 480,000 people die every year from cigarette smoking. However, the effects don't end there. Individuals who smoke are more likely to die from secondary diseases associated with smoking, which include cancer, cardiovascular disease, and respiratory disease. As a result, the U.S. government spends more than $300 billion annually to treat the effects of smoking. As you can see, smoking is a national issue that affects us all. But how should this issue be addressed? First, public health leaders must identify a target population. According to the new public health model, treatment should focus on prevention rather than medical treatment. When applying this to smoking, identifying when individuals typically start the habit is critical. Research suggests that 90% of smokers begin during adolescence, so by taking this preemptive approach and specifically targeting adolescents, public health officials can most effectively prevent individuals from considering smoking in the first place. In most cases, smoking starts at an early age and continues on into adulthood. In fact, the CDC reports that there are 4.5 million adolescents in the US smoking today. So what is the best method to target this particular demographic to desensitize them from smoking? Research using behavioral health theories can assist in the field of public health. Specifically, these theories help researchers better understand the underlying social determinants related to human behavior. This can provide health officials with a starting point to create initiatives related to the health topic. For this research and analysis, I've identified 4 theories that provided the most useful information on the topic of adolescent smoking. These include the health belief model, protective motivational theory, social cognitive theory, and the ecological model. It is important to note that every theory is useful when deriving information about a specific behavior. However, in the case of adolescent smoking, some provide more specific information to support the creation of an intervention plan. According to the health belief model, changes in behavior only occur when the benefits outweigh the costs. The model can be broken down into 2 key constructs. The first, perceived threat, is influenced by the perceived severity and susceptibility as well as cues to action and demographics. The second, expected net benefits, is influenced by demographics alone. The research article, Predictors of Smoking Among the Secondary High School Boy Students Based on the Health Belief Model, assessed how the effects of factors were related to smoking. What they found was a strong correlation between smoking and attitudes, as well as cues to action, which provided a predictor of smoking. In contrast, they found barriers to be a weaker correlation. Furthermore, the researchers identified the riskiest time for adolescents to begin smoking is around the age of 16. Based on this information, they suggest preventative means, such as using both laws and media campaigns to target adolescents under the age of 18. This research helped to identify an ideal age for targeting intervention. To further substantiate this research, further studies are required in the US. However, for the sake of this intervention, I would use this knowledge to identify a target age group. The next theory is similar to the health belief model in that individuals weigh the costs of a behavior against its benefits. However, the protective motivational theory also includes two additional components. The first, fear appeals, is influenced by a person's vulnerability or susceptibility to a given action. The second, coping appraisal, includes both response efficacy and the costs associated with a given action. This model is often used in media campaigns to scare viewers into changing or avoiding a given behavior. The research article, Adolescents and Young Adults' Response to Fear Appeals in Anti-Smoking Messages, investigated the fear levels experienced by students aged 13 to 30. The author reported that adolescents and young adults are most influenced by factual and social appeals related to smoking. Thus, as a preventative measure, the author suggests that adolescents should be targeted with fear appeals focusing specifically on factual health. A second article, Scare 'em or Discuss Them, The Effects of Graphic Health Promotion Messages, looked at the effects of televised anti-smoking campaigns. These researchers found that the use of both health threats and disgusting image material was more likely to be recalled by viewers. In contrast, media campaigns that entailed low fear messages and lacked disgusting images were least recalled. However, the author also states that media campaigns focusing exclusively on fear will cause viewers to cognitively withdraw. Therefore, ad campaigns must remain multifaceted in order to yield the greatest impact. Another useful theory on the topic of adolescent smoking is the social cognitive theory. According to this theory, nearly all human behavior is influenced by an individual's immediate social environment. Central to this theory are 5 constructs: knowledge, which includes both context and procedural; perceived efficacy, which includes both perceived and actual task-specific abilities; outcome expectation, or the rewards; goal formation. Within goal formation, individuals create sub-goals in order to help them attain goals; and the socio-cultural factors. This is geographic and cultural influences. Furthermore, a reciprocating relationship exists between the environment, behavior, and the person. In the article, Predictors of Adolescent Smoking Cessation and Smoking Reduction, the author investigates a set of demographics related to adolescent smoking. They reported that females, alcohol consumption, and increased daily cigarette use were all negatively associated with smoking cessation. Consequently, the author suggests a multi-behavioral intervention which includes both smoking cessation and alcohol use. Another article, Social Context in Adolescent Smoking, Does School Policy Matter?, looked at the effects of peers, family, and school in relation to adolescent smoking in Germany. The researchers note that a positive association exists between personal, family, and peer smoking. They also found that students were influenced by faculty smoking on school grounds. Consequently, the author suggests a preventative measure of enacting laws prohibiting faculty from smoking on school grounds. Although we have such laws in the U.S., it's important to note that peers and families also strongly influence adolescent smoking. Finally, the ecological model argues that change occurs when we alter the environment rather than the individual. Central to this model are 5 constructs: the individual, the microsystem, which includes family and peers; mesosystem, this includes families affecting peer groups; exosystem, this is a parent's workplace and marriage. It also includes the socioeconomics related to the community; and the macrosystem, this includes values, laws, and culture. The article, Social Influences and Psychological Determinants of Smoking Among Inner-City Adolescents, found that earlier smoking in adolescence led to subsequent smoking. The author noted 2 social influences, specifically the mother smoking and peer smoking were positively related to adolescent smoking. They also reported that inner-city kids were at the highest risk for smoking, and deficiencies in decision-making skills were a precursor for smoking. One shortcoming in this research was that it didn't find a positive relationship between father and sibling smoking with adolescent smoking, which is typically found in similar studies. Furthermore, the researchers suggested efforts should be made to target the mother and child relationship. A social determinant is defined as the influences related to a specific health behavior. Based on the behavioral health theories and research discussed, I would suggest focusing on the following social determinants in order to make the greatest impact on adolescent smoking. In the case of gender, boys are more likely to smoke than girls, and in regards to parents, mothers who smoke are more influential than fathers who smoke. This list also includes peers, alcohol consumption, media, low socioeconomic status, and laws. Based upon this, I would propose an adolescent smoking intervention beginning with a multimedia ad campaign targeting low socioeconomic communities. These ads would feature adolescent actors and contain both factual information and graphic images demonstrating the long-term physical effects of smoking. The ads would elicit a fear response while also depicting scenes involving peer and sibling interaction. I would also create a state-mandated school education program for all ninth grade students, which would include both an educational and interactive portion. The educational portion would include information about the dangers of smoking, specifically related to the physical effects. It would also discuss the social group influences and address the correlation between smoking and alcohol consumption. Furthermore, I would have the kids break up into groups and role-play situations that they might encounter related to smoking. Finally, I would ensure that laws and rules existed to ensure the prohibition of smoking near and on school grounds. In conclusion, the individual, family, and community costs of cigarette smoking are still extremely high, and the most effective means to reduce these costs is through intervention and education before young people begin the habit. 4 specific behavioral theories were discussed, and published research involving each theory provided a number of risk factors and social determinants for adolescent smoking. From these, I developed and proposed a hypothetical intervention strategy to address adolescent smoking. This project provided a great opportunity to explore how people in the field of public health can develop interventions to target specific behaviors. The following 2 slides contain all of my references.